Next, I'd like to introduce Dr. Lindsay Van Zandt. I first met Lindsay when she was just starting as a postdoc in Bill Swanson's conservation program at the Cincinnati Zoo. I've had the privilege to work with Lindsay on the study that ACC&D conducted with GnRH, and now I have the privilege of introducing her for her talk.
Well, good morning, everyone. Just to give everyone a disclaimer, so what my role is in this is at CREW, we're uniquely posed to evaluate many of these products as they kind of come through the pipeline. So as a veterinarian, obviously we can look at the safety, and as reproductive physiologists, look at the efficacy. But when it comes to how the constructs are made and produced, I have a less than optimal knowledge of that. So what I'm presenting today is our work with our collaborator, Bruce Hay, looking at AAV-Vectored generation of GnRH-Binding immunoglobulins. So I'm sure this information will fall on very friendly ears with this crowd, but I always feel compelled to have at least one slide justifying why it is we're doing what we're doing. So there are about 80 million free roaming cats in the United States. We also know about 3 million animals are euthanized in shelters each year simply due to a lack of space. Additionally, as it turns out, cats are carnivores, and so their presence has really negative impact on birds and other wildlife species. So of course, historically, we've used the trap, neuter, return approach using surgical sterilization. And while this can work, there are some difficulties. Of course, this is very expensive. This can be very labor intensive, and this is surgery. Only veterinarians should be doing this, and that can create quite the bottleneck in these efforts. And so our dream, of course, along with ACC&D, is to, let's see if I don't push the wrong button, is to make sterilization, rather than look like the top panel, look like this, right? So of course, this would be a much more field-friendly option. So one of the most common targets that we go for is gonadotropin-releasing hormone, or GnRH. And that is because it is indeed a master regulator of reproduction. So if you look, whether we're talking about the male or the female, you can see here that GnRH sits on top of this hormonal cascade. Now, historically, these have been targeted with immunocontraceptives, and we've heard about those throughout this conference. So in essence, an animal is vaccinated against its own hormone. And we've talked about this study a lot in this conference. Julie Levy did great work looking at GnRH, one such agent, and showing that indeed in cats, you can get about 3 years of contraception. So with our work, through our partnership with ACC&D, we did a follow-up study looking again at GnRH because USDA is who produces this, and they had changed the formulation. So we did a small pilot study looking at, again, just safety and effectiveness. And so we got very exciting results. It appeared to be safe. We didn't have any major injection site reactions. We looked at the titer levels, and they looked really high. For reasons I won't get into today, just the way the study worked out, we were actually doing this on spayed cats, just because we were doing a very small initial study. And I'm sure Amy Fisher talked a little bit about this yesterday, and we'll hear about this more, did a much larger study, and unfortunately, the results were not as encouraging. The titers were not up there. And so this does not appear to be a good avenue for us to go down. Additionally, if we look at the research in dogs, dogs' main issue is they have really bad injection site reactions, really bad, really nasty wounds. But even all of these issues aside, ultimately the issue with these immunocontraceptives is that we are indeed depending on the immune system. And so, eventually these cats will need to be boosted if we want to have permanent contraception. And so that's really the impetus for the approach that we used. So rather than depending on the immune system to, say, produce these GnRH antibodies, we are using the muscle cells. And so please forgive me again, everyone in this room that's familiar with gene therapy, works with the AAV constructs. I have a very simple explanation I always like to give. I think it kind of helps the rest of us kind of understand this approach. So what we have is the blueprint, right? The DNA blueprint that tells what is the structure of this cat GnRH antibody. That is then packaged into these vessels. That is the adeno-associated virus, or AAV vector. And so this isn't truly a virus. It's the part of the virus that knows how to get inside of the cell. And so we then can use that and inject that. And in our case, we inject into the muscle cells. And then we'll go to the level of the muscle. And so what happens is this AAV vector then allows that blueprint, the DNA, to then move inside the nucleus of the muscle cell. And now that muscle cell has its instructions and knows, okay, I need to produce this GnRH antibody. And so we call this vectored contraception. And so what our collaborator Bruce Hay did was initially determined the sequence using mass spec of a high-affinity anti-GnRH monoclonal antibody that's from the mouse, SMI41, and then used an AAV-28 vector. And so I'm going to show you some of his data from his work in the mouse. I feel like I'm so close, it's going to be really hard to point. So basically what we're looking at here is the titer levels of the mice over time. And so whenever you see a black line, well, let me back up. So this is in female mice that were treated with AAV. And so for 8 weeks post-treatment, they weren't introduced into a breeding situation, but after 8 weeks, a male was introduced. And so what you can see is all of those black lines are females that did not become pregnant. The red lines represent all of the failures, i.e. where a female was with a male and did get pregnant. But notice that by and large, all of those red lines are with those lower titer levels. As long as those titer levels remained above 200 micrograms per mil, there were very few failures. Similarly, doing the same study only with the males, so now the males are treated and then put in a breeding situation with a female, by and large, as long as those titer levels remained above 200 micrograms per mil, the males were unable to impregnate females. It's only when those titer levels in those lower amounts would actually be able to successfully breed. And so what we wanted to do is then determine if using that same vectored approach, that AAV-28, expressing the SMI41 antibody, can that induce long-term infertility in the domestic cat? So this was a small study. We started with just 3 cats using 3.4 times 10 to the 13th of that construct. And I should mention that he did change it from the mouse. This was still that mouse monoclonal antibody. He did do some modification to make it more felinized. So the FC region was made to look more like a cat than a mouse. Again, hoping to avoid an immune reaction. And then we had 3 control cats. We call these our sentinel cats that were not injected, but then co-housed through the study period, just looking for shedding to see if there's any ability for horizontal transmission. Okay, so then we, of course, drew blood because we wanted to actually look at the titer levels over time. So the first 5 days, we did daily blood draws. For the next month, we did weekly. And then for the next 6 months, we did monthly blood draws. Additionally, we non-invasively monitored their hormones through an in-house ELISA using their feces. And so we broke this down into 3 areas. So we actually took samples for the 4 months before actually treating these cats. And then looking at treatment, so that initial 30-day period, we don't have samples from days 1 to 7 of treatment because that was a quarantine period. And we treat all of these at BSL level 2. And so basically everything is incinerated and dealt with properly as biohazard waste. So we don't have those samples. But starting from day 7 to day 30 is the treatment period. And then the post-treatment period would be months 1 through 6. Now, one point I want to make is consistent among these 3 cats, there were no injection site reactions, no adverse events, and no off-target effects of the construct throughout the 6-month post-injection observation period, which is great. So, of course, we looked at the antibody production of this anti-GnRH antibody, SMI41. So the 3 lines in green are the cats that are treated, and then the 3 lines in red were the sentinel control cats. And so pretty similar among the 3 cats. What you see is an initial rise in the titer level, and then it kind of goes back down and plateaus out. And now this is pretty consistent with what they saw in the mouse. But what I want to point out to you is the level that you were seeing. I'll remind you in the mouse that the threshold titer level was around 200 micrograms per mil. And note that in the cats, we were not close to reaching that level, more in the 10 to 20 micrograms per mil. And so the fecal hormone data reflected that low titer level as well. So again, we're looking at this based on the pre-treatment, those 4 months before treatment. Where you see the syringe is actually at the time when we gave them the construct. And so then you have that 1 month treatment period, and then those 6 months post-treatment period. We look at two hormones, estrogen and progesterone. So estrogen is in red. And what you can see before the cat was treated is some cyclic rises and falls along with ovulation. I'll remind everybody, cats are classically described as induced ovulators, meaning they have to breed to ovulate, but we often see spontaneous ovulation with our cats. It's sort of an individual variation. And you can see with Marigold that she was spontaneously ovulating before treatment. But then after that treatment period, we don't see any suppression. And again, you can see that cyclic rise and fall. Looking at the next cat, Saba, also before we see some spontaneous ovulation. Following treatment, again, unfortunately, she resumed cycling rather quickly and even demonstrating an ovulation. The last cat, Tobago, she is not one who spontaneously ovulates. You can see that before. So we can't use that as a nice metric of whether she was cycling. But of course, she still has the estrogen rising and falling. And you can see post-treatment, there's a couple of really nice estrus phases. And so, of course, this was disappointing, but not surprising based on how low the titer levels were. And recall that, oh, I'm sorry, let me tell you this. We also looked at this a little more quantitatively. So actually looking at the average values for estrogen and progesterone. And there is a slight trend downward during that treatment period, but of course not significant. So, of course, this is disappointing. So what we suspect, similar to what David just presented, is what we suspect happened is that the cat's immune system recognized these anti-GnRH antibodies as non-self. So really, we just saw the beginning of the peak, and the cat started to produce antibodies. So Bruce and his group developed an in-house ELISA to look at this. And so each bar represents an individual cat, and the ones in green, again, were the treated cats. The ones in red or the control cats. And what we're looking at, and this gets a little bit confusing, is not the anti-GnRH antibody. It's antibodies against that anti-GnRH antibody, if that makes sense. So anti-SMI41 antibodies. And so, of course, before treatment, it's quite low. And you see it takes a few days, but right around 2 weeks, you start to see those treatment cats go up. And you can see by 21 days, it goes up quite significantly. And that goes along really well with the timeline of how we started to see that rise in that SMI41 production, but then we saw it go back down and plateau out. So these results, I think, both highlight the potential of this approach, but also the need for additional studies. We are excited that we were able to produce a functional GnRH antibody in the cat using a recombinant AAV-Vectored approach. And again, that suspected immunogenicity is probably what prevented that threshold titer level to be reached. Thus, we were unable to actually inhibit the ovarian cyclicity. Of course, we always thank our funders. Thank you, Caltech, and Joni Bernard Foundation, who also pays my salary, so thank you. I always like to thank my team at Crew, of course, Dr. Bill Swanson, who's here, and the rest of our group. We have an amazing team of cat keepers who make all of this work that we do possible, and I guess that's it. Any questions?